Hey, hello there, class. My name is Joshua Rios, and I'm one of the participants of the West Nile virus presentation. So, hope you guys enjoy the presentation. Hello, hello. Um, as you can see here, this will be a presentation about the West Nile virus, um, also abbreviated WNM. And as you can see here in the picture, there's a picture of depiction of a mosquito. So a lot of the virus and the spreading has to do with mosquitoes. So that's something um, to be mindful about. Um, if we look at this, we'll be looking at the etiology of the West Nile virus. And as you can see here, there's a picture, a microscopic picture of what the West Nile virus looks like. We could see here that the West Nile virus is enveloped and spherical with a diameter of 40 to 50 mn. The West Nile virus is a member of the flavivirus genus of the family Flaviviridae. So hopefully I said it right. Flaviviridae or Flaviviride, either one. But you get the whole idea. Um, the West Nile virus is an envelope variant that contains a single-stranded RNA genome. So that's something important to know, that it is RNA encoded. So also, the RNA encodes three flavivirus structural proteins, capsid C, membrane M, and envelope E. It also has non-structural proteins. So that's the etiology of the West Nile virus, and it's pretty important because it tells us about the genus and family, and talks about the structure of it, and talks about the proteins that it contains. The second part of this would be the reservoir of the West Nile virus. And you can see here there's this little diagram here with pictures, and it has pictures of a bird, mosquito bird, and then humans and horses. But something to really consider about, and something to know about the West Nile virus, is that birds are considered the reservoir host of West Nile virus in Europe, Africa, the Middle East, and Asia. The West Nile virus is maintained in nature in a mosquito-bird-mosquito transmission cycle, so that's how the virus is able to survive from bird to mosquito, and so forth. And mosquitoes of the genus Culex are considered the principal vectors of the West Nile virus, particularly CX pipiens. So these are like the main culprits, these mosquitoes, to spread the virus of the West Nile virus. And pretty much these mosquitoes, when they bite, they can infect humans and animals. But something to also be mindful about is that humans and, for example, horses, they are dead-end hosts, which means that once they contract the virus, then they can't spread it any further, so the virus dies with them.
Do you want to know about the signs and symptoms of the West Nile virus? Well, you're in luck, because we're going to do it. Alright, so a sign is any objective evidence of disease as noted by an observer. In other words, a sign is something on the outside that observes happening in the patient. A symptom, on the other hand, is the subjective evidence of disease as sensed by the patient. So it's something that the patient notices happening within their body. Signs and symptoms of the West Nile virus range mild to severe. 80% of all patients with the disease show no symptoms at all. So some of the milder symptoms may be fever, headache, body ache, skin rash, swollen lymph nodes, and then some of the severe symptoms can be mild symptoms plus stupor, disorientation, tremors, convulsion, coma, and paralysis. So transmission, how is the disease transmitted? So it's transmitted through mosquito bites. Mosquitoes bite humans, and that subsequently transmits the disease. Studies on the genes of the West Nile virus suggest that it first evolved in Africa, and that as birds migrated from Africa to other continents, they spread the virus to new bird species and eventually to mosquito vectors, which transferred the virus to other birds and humans. When a mosquito bites an infected bird, the virus enters the mosquito into its bloodstream and eventually moves into its salivary glands. When an infected mosquito bites an animal or a human host, the virus is passed into the host's bloodstream, where it may cause serious illness. We know this as the West Nile virus. So some of the diseases associated with the West Nile virus is West Nile meningitis. West Nile meningitis symptoms consist of meningeal inflammation, which is inflammation of the brain and spinal cord. This also includes nuchal or neck rigidity. Koenig's sign happens, and that's thigh tightening. Photophobia and phonophobia are also symptoms of this disease. Evidence of fever or hypothermia and increased blood cell count neuroimages also were consistent with acute meningeal inflammation. So another disease associated with West Nile virus is West Nile encephalitis. Encephalopathy means that they're depressed or altered in level of consciousness. They're lethargic. They can also have a personality change lasting more than 24 hours is what they typically would count as a symptom of the disease. Additional evidence of central nervous system inflammation includes 2 or more of the following: fever or hypothermia, increased white blood cell count, problems with nerve or the brain, spinal cord, same type of thing due to inflammation. Electroencephalography is also consistent with encephalitis. So then the last disease that we're going to talk about is acute flaccid paralysis. This happens, it's an acute onset of limb weakness with marked progression over a 48-hour period. At least 2 of the following will happen. It's asymmetric weakness, an absence of pain results, paresthesia, or numbness in affected limbs. Elevated protein levels, also cerebrospinal fluid plectosis, spinal cord magnetic resonance imaging documents, also increases in anterior gray matter. So a reminder that although most cases of the West Nile virus are asymptomatic or only mildly symptomatic, some patients may experience more severe and protracted versions of the illness. So now we know about the West Nile virus.
Hi, my name's Briar, and I'm excited to share with you guys some of the interesting things I learned about regarding prevention and treatment of the West Nile virus. In 2012, the U.S. had the biggest West Nile virus breakout they had ever seen. According to the CDC, there was a total of 5,674 cases in the states and 286 deaths. The epicenter was Texas, and other main affected states were California, Louisiana, Michigan, Mississippi, Oklahoma, and South Dakota. The Centers for Disease Control said in 2013, last summer's outbreak likely resulted from many factors, including higher than normal temperatures that influenced mosquito and bird abundance, the replication of the viruses in its host mosquitoes, and interactions of birds and mosquitoes in hard-hit areas. Because the factors that led to the West Nile virus disease outbreaks are complex, they cannot predict where and when they will occur. While the breakout was still going on, CNN came out with a news report to give warning preventative measures, which they called the 4Ds. These were: use mosquito repellent with DEET, dress in long pants and sleeves, be especially careful at dusk and dawn, and lastly, drain any standing water, such as kiddie pools or bird fountains, where mosquitoes like to breed. Because there is no vaccine and no specific treatment for the West Nile virus, prevention is extremely important. The CDC and MedicineNet.com give a few other ideas that both individuals and communities can do to prevent West Nile virus outbreaks and infection. These ideas are screening for blood and organ donors, community-level mosquito control. People can also have their individual homes and yards sprayed, and monitoring the bird population, like surveying sick and dead birds to see if they're infected. As for treatments, there are some general things that can help those suffering the symptoms of West Nile virus, such as over-the-counter pain medication, staying hydrated if they're vomiting or have diarrhea, or in more serious cases, IVs, anti-inflammatory medications, or intensive medical monitoring. The CDC also reports that various drugs have been evaluated or empirically used for West Nile virus disease. However, none have shown specific benefit to date. Many people have taken the time to share their experiences from suffering from West Nile virus, and what was very interesting to me is that every case I read was different. And I would like to just share a few cases with you in regards to their treatment and how things ended up with the disease. So the first one was a woman in eastern Idaho who kept a record of how she was feeling and what went on when she found out that she was suffering from West Nile virus. After a little over 2 months of suffering from sickness, dizziness, fevers, headaches, and staying at home to rest and recover, she recorded, "I'm still having bouts of dizziness. They are typically less severe than they have been. I have regular headaches, unusual for me, and I am having sensitivity to sound. Low frequency sound seems to really affect me the most. Still, I am very happy to be doing as well as I am. Not all are as lucky. Without intensive care, rather with relaxation and over-the-counter medications, this woman was able to basically recover from West Nile virus." But, like she said, not all are as lucky. Back in December of 2008, a teenager girl in Menifee, California, which is actually only about 20 minutes away from my hometown, died after a 4-year battle, which started with West Nile virus and led to West Nile encephalitis. And you can see that picture. That's her right there. She started with the same disease as this lady in eastern Idaho, but she ended up with an entirely different outcome. And one last experience that I found extremely interesting was that of a surgeon who contracted West Nile virus in Dallas, Texas during the 2012 outbreak. The disease affected him terribly, and his treatment and recovery consisted of being in the ICU for over 4 weeks, 2 months in a rehabilitation hospital, and 1 month of home care, and 3 months of all-day outpatient rehab. He wrote, "I had to relearn how to walk, how to talk, and how to write. I was out of work for 7 months. When I first went back to work, I could see patients for only 1 hour before I had to go home, exhausted, and go back to bed. It took a year to be able to work 35 hours a week. Because of the residual leg weakness from the polio-like paralysis, I have to wear braces on both legs and therefore had to give up performing abdominal surgery. Although it continues to improve very slowly, my stamina is far from normal. I was working 88.7 hours a week when I got sick. Now I can only work 35 hours a week. I'm happy to be alive, but my body will never be normal again." As you can see, the treatment for West Nile virus victims varies depending on what their symptoms are like. Some need much more medical attention than others. Because this is unpredictable, it is extremely important for communities and individuals to use the preventative measures given to them for their best chance of staying away from West Nile virus. I hope you guys were able to learn some neat, interesting things about the West Nile virus.